This Wednesday, we're talking about traditional pain medication shortages in general and morphine specifically and how we can stop them, as well as telemedicine, AI, and how these technologies should set us patients free. Hey, all, I'm Marlon with Chronic Pain Warriors United. I hope y'all are all doing well and having a great week and a great Wednesday so far. Let's jump into it. For years now, us as chronic pain patients have been dealing with traditional pain medication shortages of all kinds, everything from codeine to oxymorphone. And we know why. It's because, once again, the DEA, ding, 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 has been ordering these things to be cut. They give orders to the pharmaceutical industry, how about this, every single year since 2015 to cut traditional pain medication production. Now, their power to do this comes from the Attorney General. And here's a Pain News Network article that I've talked about before that's talking about the cuts that they're ordering for 2025, which are very small compared to the whole. But when you compare it to the whole, which it is talking about, they are massive. Hydrocodone, for instance, has been cut by over 70% since 2015, oxycodone by over 65%, and morphine by over 66%. It doesn't take a genius to figure out why we are having these shortages. And the quickest and easiest way to reverse them is to have the Attorney General order the DEA to retract these orders from the pharmaceutical industry. It's that easy, technically. Their power to do this flows directly from the AG's office, and the AG absolutely has the power to order them to do this. The president has the power to order the AG to order the DEA to do this. So it can be done, and it's one of the first and biggest goals of us here at Chronic Pain Warriors United, because it would benefit countless numbers of people. The last month or so, there have been a lot of people on the comments here, Reddit, X, and other places talking about how they can't get their pain medications and they're being forcefully and against their will put into withdrawals because of it. There is no reason that people should be treated like this. This pain medications are viewed by the pharmacists and doctors and everything else, I guess, as a luxury, as a privilege, when in fact, they are life-saving medications. And yes, some people may scoff at that. Look at this. They are life-saving medications. There is pain that once it gets to a certain point cannot be ignored. And that is why so many chronic pain patients have either lost their lives trying to self-medicate in a dangerous black market or have taken their own lives, which is what our co-founder, Jonathan, did when they came up against the end of their rope. It has happened to far too many people. So this is my point. When other people go into the pharmacy to get life-saving medications, which pain medications are, they are not treated like addicts or criminals, and they are not held to one specific pharmacy at one specific time because of some pain contract or some ridiculous, asinine, bureaucratic regulation. And that is what's happening to countless numbers of us all across the country every day. We're being subjected to basically constant medical discrimination just because of the type of patient we are and the medications we take. And there is no cause for it. So, like I said, one of the biggest and first goals that we have is to put pressure on whoever we need to, most likely the president, to force the president to order the AG to order the DEA to undo these things. That's the quickest and cleanest way for it to get done, because that's how it was done in the first place. So then linking AI and telemedicine to this, If these problems were done away with, say we had no shortages of pain medications, which we wouldn't if the DEA had not been intervening, telemedicine and AI should set patients like us and all kinds of others completely free. Pain patients that are mostly disabled, don't or cannot commute for whatever reason, it would help people like you massively, or others like y'all that are in these pain deserts that have to drive for huge amounts of time to get to a pain clinic. That they would help you, or people like me who just have no desire to be around medical professionals any more than I have to be. If I could use a telemedicine AI system to get my medications without ever having to go to a pain clinic or see a pain doctor or anything else, I would take that road in a heartbeat. And I bet a lot of y'all would too. Let me know in the comments if you would. And that's what I mean by these things should set us free. They there's no reason for us to be having to travel these massive distances to pain clinics. There's no reason for people to be running out of their pain medications like this. And with the technologies we have now, there is absolutely no reason at all that anybody should be living with untreated or undertreated pain. There's just no cause for it. There are far too many ways that we could let people access pain management that we are not allowing. And if you can think of any and you'd like to shout them out, let me know in the comments. This is what we're here for. We want to start implementing these things and forcing them into law, regulation, changing the system. And it's going to take time. Building a grassroots movement from the ground up takes a little bit of time. But I'm on fire for this, and a lot of y'all are too, because people's quality of life and their lives themselves are being destroyed or lost every day due to a completely preventable thing. Them losing their pain medications, being that's another thing. When these doctors cut people's medications without their consent, that's so damaging. But another thing, having their medications non-consensually taken away, or pain clinics or the pharmacies don't have them, whatever it is that causes them to not get their medications. Almost all of those situations are 100% preventable if the DEA was not intervening. And then there's other amazing ways AI can change the system. Like with cancer detection, there are a lot of people who think AI has already surpassed doctors when it comes to cancer. And I would say we're either getting close or we're already there. And differential diagnoses, like what House did, that's going to be another thing that it's going to be amazing at. But it should set us free and change our lives if we were allowed to use it freely and properly. So let me know what you think in the comments. Let me know how you're dealing with these shortages, if they're affecting you. If you would use an AI telemedicine system to get your medications if you could. Your stories, like you, are unique and special, and they mean a lot in the movement for reform. When people see these stories and they haven't heard them before, they're blown away. They are an amazing boon in the fight for pain management reform. So please leave your comments, hit the like and subscribe button. I'm Marlon with Chronic Pain Warriors United. We'll see y'all real soon. Cheers and be well.